Hello everyone, my name is Veronica Schiariti. I am a developmental pediatrician and a global child health researcher. I am pleased to contribute to this session on the topic of CDEs and ICF Core Sets for cerebral palsy. And it's really nice to share this topic with an European audience. Compare the content of the common data elements to the ICF core sets for CP. We need to start defining each one of them. So let's start with what is a common data element or CDE. So the CDEs consist of specific terminology with identification of common definitions, standardized case report forms, and standardized tools or instruments. That means different types of scales or measures. CDEs and tools are classified about the level of recommendation for use in research studies, and you can find more information on the NINDS website and in all the publications related to the CP CDEs for cerebral palsy. And the ICF Core Sets for cerebral palsy are a list of ICF categories out of the entire ICF classification that serves as international standards for describing functioning and disability for that particular population with that specific health condition. ICF Core Sets summarizes what should be measured and reported for a given population, and in this case is for children and youth with cerebral palsy. The NINDS and the American Academy of Cerebral Palsy and Developmental Medicine have been collaborating in the CP Common Data Elements project since 2015. We were pleased to publish in 2018 the first paper describing the development of the CP Common Data Elements, and recently we complemented the information with the CP Pain instruments that we describe in this paper. Since the publication of the ICF, there has been increased interest in not only standardizing data collection, but also in understanding the functional abilities of individuals living with CP and the challenges they face in performing everyday activities. As such, international initiatives such as the CDEs and ICF-based tools like the ICF Core Set for CP have recognized the importance of universal, standardized, and comprehensive data collection. Despite differences in methodological approaches, the CDEs and the ICF-based tools put special emphasis on valid and reliable measures for individuals with CP. The common goal is to deliver best quality of care. However, some relevant areas of what to measure regarding functioning are underrepresented by the current version of the CDEs. These areas will be addressed in future CDE revisions. When we compare how to measure relevant areas of functioning in CP proposed by the current CDE set of tools to the recently developed ICF toolbox of measures for CP, we found that the CDEs include a much more comprehensive set of tools, including single item and multiple item measures. However, the CDE's recommended tools highly represent the ICF component body functions, whereas the ICF toolbox of measures focus mainly on the ICF component activities and participation. Finally, we want to emphasize that standardization proposed by the CDEs promotes the application of evidence-based medicine or the best available evidence in a systematic way to ensure individuals receive effective care. We need less variance in clinical practice to achieve more consistent outcomes and improve quality of care and patient safety. Most importantly, standardization can enhance personalization by eliminating unnecessary time and cost of using low-quality assessment tools or ignoring opportunities to obtain relevant clinical information. To draw your attention to a concrete example of how the ICF and CDEs complement each other in the field of cerebral palsy, and you are seeing the latest publication in 2023 dedicated to CP Pain instruments. Importantly, in the discussion, there is a dedicated section and a figure that guide readers on how to use these recommended tools, illustrating how to select the best chronic pain measure for your practice or your study, depending on the age of the children that you are seeing, the purpose of the pain assessment, and the pain domains. The guiding framework of the project was the ICF, so we also organized the results by ICF domains. We want to emphasize that no single tool covers all the ICF components, so a combination of measures is needed to truly represent the impact of chronic pain on the daily functioning of children and youth with cerebral palsy. You can find examples and more information on Figure 1B. Lastly, we acknowledge that the current proposed set of tools underrepresent some functioning areas, for example, impact of chronic pain on sleep pattern, coping strategies to stress and chronic pain, and attitudes towards pain that are based on belief or cultural and ethnic backgrounds. In conclusion, the proposed chronic pain tools harmonize the assessment of chronic pain in children and young people with cerebral palsy. And most importantly, the contribution of this paper is that the new CP Pain common data elements address the functional impact of chronic pain in everyday activities in children and young people with CP. After a rigorous process, 15 chronic pain tools met inclusion criteria, representing content across all components of the ICF. Table 2 shows a detailed description of each recommended measure, including the purpose, the psychometric properties, the representation of PROMIS pain domain and ICF domain, and CDE's recommendation level. 8 out of 15 were classified as supplemental. The rest were exploratory. I hope that this brief presentation make you curious to read more and join us on this global collaboration and learn about future CDE revisions and participate in future CDE revisions. Try to apply the CDEs and the ICF core sets in your practice, in your future research projects, and be curious and learn more about this project. Once again, you can find all the information related to the CP CDEs on different platforms, the NINDA's platform, the Journal of Developmental Medicine and Child Neurology, and then you have different podcasts that are available to you and all the open access papers. So hope you enjoy the reading and checking these materials, and thank you for your attention.